Hi, my name is Clare Baumann, and I'm a part-time student in the DNP program at Madison, and I also work as a full-time nurse in the inpatient orthopedic unit at the hospital. In looking further into some of the issues related to health informatics in the workplace, I really didn't have to go much further than looking at the IV pumps that we just started implementing in the hospital. As we discussed in class, more often than not, we look to the implementation of technology to really improve safety and increase some of the efficiency in workflow. Yet when new technology is not streamlined, it definitely increases the workflow and can create kind of a financial burden, making it very difficult for staff to adapt the new model. Most recently, we have taken on new IV pumps in the hospital to better improve patient safety. By doing so, we have to scan our ID badge to actually access the pumps, which prevents family or friends or anybody else from actually utilizing them. And we also have to scan medications when we hang them, which provides another lockout mechanism so we don't overdose anybody and we stay within the regulations of the hard limits that they set by pharmacy and the hospital. Although there's a lot of safety mechanisms that I think are really great with this kind of action, I found that some of the costs and time with education, implementation, and some of the features that it may have missed really to be a problem with informatics involved. I think to adapt this type of technology, it'd be very beneficial to be able to actually communicate these two devices together. As of right now, the IV pumps they do not communicate with Epic, which is our electronic health record system. By relating these two machines, the nurses will not only have a more accurate representation of specific rate changes, such as when we're hanging insulin drips or heparin drips, where we have to change the rate every hour or two. It's also the timing of the medications when we administer them, and also the I's and O's, which can be critical in a cardiac unit or a medical unit where we're monitoring those. Although in my specific unit, we usually use the IV pump simply for maintenance IV fluids, for any kind of pain management, and antibiotics. In ICU where they have 5, 10, 20 different drips going on, I think it'd be a lot more beneficial to be able to have these IV machines be able to communicate with Epic and make those kind of associated. It not only allows for the nurse to know the exact time of when they hung the medications, did a rate change or anything like that, but we'd be able to keep a little bit better accurate of input and output, and also be able to reduce the time where we repetitively chart. Often we end up scanning a medication and doing a lot of different other steps and not necessarily coordinating all of it together, which makes it really tough. So we end up charting it in 2 or 3 different places, which isn't very time efficient. So if these two machines would actually be able to communicate, we'd eliminate those steps. Another thing that I really think would be beneficial for these pumps to have, in addition to being able to scan the medications, would be an additional safety measure. I think they could really benefit by able to use the IV compatibility charts. Often when we have a couple of different IV fluids running, we end up having to double check with the pharmacist, as well as possibly micromedics or somewhere on the computer to be able to determine if these two different medications are compatible. With us being able to scan these medications, I think it'd be great if we could be able to have a red flag if they were for some reason not compatible. Often this is something that'd be really simple, I would think, to be able to utilize, but doesn't seem to be incorporated in the new technology that we're implementing. Although there are definitely bigger issues in healthcare related to informatics, especially in the workplace, I do think that by starting small and implementing change in units, we can have a great impact. One of the biggest obstacles to overcome in health informatics is making sure that the new technology is able to communicate with one another. As you know, healthcare is a billion-dollar industry, and it's really hard to make these different businesses make equipment that actually communicates with one another. I think this is a hard thing to be able to do, but I think it's a step in the right direction. I know that it will definitely improve some of the workflow and the safety for patients if we're able to really tackle this device. Thanks again for listening into this. I look forward to working with all you guys this semester and talking a little bit more about some of the global issues related to health informatics. Thank you so much.